Welcome to Talk 1260 KTRC. This is the Humanity Behind the Vanity. This is Dr. Daniel Ronel. I'm here with my wife, Betsy.
Happy May.
Yes, we're talking about plastic surgery and the realities behind plastic surgery and other things. Like, what do you want to talk about this week?
We need to thank your sponsors.
Oh yes, thank you, Suniva Medical, the makers of Artifil.
Okay.
Great, long-acting, versatile filler.
Love it.
And go ahead.
Okay, so we're going to start off with Courtney Love.
Uh-huh.
She's back in the news again because she's had more plastic surgery, so people say, allegedly. Whatever the word is, supposedly. Okay, and she was on Jimmy Kimmel the other night. In fact, I didn't watch Jimmy Kimmel because I'm a mother and I'm like asleep by 9:30. But anyway, no, I'm kidding.
That's
not really.
not true at
No,
all.
it's not true. But no, I don't watch Jimmy Kimmel that much. Anyway, your blog person sent us this link, and she said,
Right.
check out Courtney Love. People are really talking about it.
Mm-hmm.
So we checked it out.
Yeah, I looked at it. It looks like I'm not her doctor, so I don't know, but it looks like she might be recovering from something. Her face is a little swollen. There's a little lumpy, bumpy stuff, but she might have had a facelift, which is fine. She's what, about 40?
I think she's in her early 40s.
Okay,
But I don't know her, so I can't tell you.
and that's the right age. She may have had filler. She may have had.
She didn't just have filler.
Right. She had a lot of makeup on.
A ton of makeup on. Face makeup.
Yeah, but she looks great.
She looks great. I do not mean this in any way whatsoever. It's just hard to tell. I looked at her as just an average consumer, and to me, it looked like she had a facelift. And it looked like she had her eyes done, because they looked really crisp. And
Yeah.
it looks like she's had all that junk taken out of her lips, which made them too big. Her nose looks good. She looked good. She looks too thin,
Yeah.
but she looks good. And she had a ton of makeup on her face.
Right.
And again, not eye and lip, just face makeup, which means she's covering something.
She's a celebrity, so I'm sure a lot of people are going to weigh in on
Of
how they
course.
think she looks.
I think she
and
looks good.
It doesn't really matter.
No.
Right? It's how she thinks, she feels, how the patient
Sadly,
feels.
a lot of these celebrities do care what the public thinks, which makes their lives so nutty. But I say yes, Courtney, you look good. How about that? From little
Okay.
Betsy Ronel in Santa Fe, New Mexico, I say you look good.
Then the fact that if she had a facelift in her 40s, that's great. We've talked about this before. That's a great time to do it because it's easier. The procedure is easier. There's less recovery time, less of a dramatic change. So she'll sail into her 60s looking really good without really needing very much.
Why say a woman was like, oh, I like the aging process, and she did not have a facelift through her 40s and 50s, and then
Right.
decided at 65, oh God, I'm not looking good.
Okay.
What's the kind of difference you can make in that face?
That's a perfectly appropriate age to get a facelift too.
Mm-hmm.
You just won't get as much of a change.
Why?
And because by that time, the facial substructures have really aged significantly. The underlying bones and the tissues and the collagen, so the wrinkles are deeper, and you can't pull them up as tightly as you could have if you had done the procedure 10 years before. We talked about this before. The facial skeleton drops and goes forward a little bit as you get older. So an older person who gets a facelift is still going to look fantastic. They're going to look rejuvenated and they're going to look more refreshed, but the change is not going to be
It's dramatic.
well, it's going to be a little bit more involved. The recovery will be a little bit more involved than if they had done it much earlier. And the surgeon just can't really pull as tightly.
It's also
Either.
not about age. Like, I'll be 40 next year. I'm not ready for a facelift.
Right.
I'll probably be ready if I keep taking care of my skin in my
Right.
50s for my very first one.
Correct.
So it's not
Right.
really about age necessarily.
It's not. And I just saw a lady today, and I'm going to do her facelift next week, and she's 73. And she's got a lot of wrinkles. She's got a lovely face with high cheekbones, but a lot of sagging, and she wants to get rid of some of that sagging. I can't make her look like a mannequin. She's not going to look like Courtney Love looks, but she's still going to look much better than she does now.
But does a 73-year-old woman say, I'm coming in, I want to look 43?
No.
Okay.
No.
That's just insane.
Right. In my office, what's important is I tell people I can't make you look a certain age. I can't make you look like somebody. I can do this or that to this or that part of your face. And so the best, the person with the most realistic expectations is going to say, I have this jowl, I'd like it to be less pronounced, or I have these deep lines, I'd like them to be less pronounced. That's a much more realistic thing than saying, I want to look 10 years younger. Because you can't predict that.
Yeah, so, right, I know, and it's interesting, there's a lot of talk in the news now about potential alleged plastic surgeries that not movie stars, but TV stars have had. Like, I think it was OK Magazine, I forget which one of those magazines. Kim Kardashian is said to have had some plastic surgery, her cheeks possibly enhanced, her nose done a couple of times, and then people were saying she has fat injections put in her behind, which is already ample in size. I don't know. Then, like we said in the other show, they're guessing that Kate Hudson had her breasts done just a little bit fuller. And then
I think it's great that people are talking about plastic surgery, because that has always been the case ever since I was a kid growing up. What's different now is that plastic surgery is more affordable, and it's more
out in the open.
It's more available to people who, before were just onlookers. Now, with our financing programs and with the openness of our society and with the reality shows, it's more accessible to the school teacher, the fireman, the postmaster person, the mail deliverer, and so it's not just for movie stars or not just for the rich and famous. I think it's great.
Right. Yeah. It's just these talks always go on about potential plastic surgery that people have had, possible plastic surgeries, but there's like a ton of them right now that's going on. Courtney Love and all these other people in these magazines right now, these gossip magazines.
Mm-hmm.
So.
I saw something on Heidi Montag. We talked about her before, and there was I was in the supermarket and I saw she's hooked on painkillers.
So that's what they said, right?
So soon after surgery, she had her surgery
She's had
a couple months ago.
She's had a lot of surgeries too.
Okay, and she just had it a few months ago.
She has enormous implants.
So of course,
she's uncomfortable.
Right, and she's going to take pain medicine. It doesn't mean she's hooked on painkillers. Many of my patients who have big procedures, they need to take narcotics off and on for 2 or 3 months. It doesn't mean that they're addicted, and even if you get sort of dependent on it, you can wean yourself off of it. So that's not it's an unrealistic thing to say.
All right, fine. It's interesting what celebrity can do to people.
All right, we actually have to wrap this segment up. On our next segment, we're going to talk about listener emails.
Right.
I also wanted to mention we have an event coming up on May 19th, Wednesday, May 19th at the Be Beautiful Salon. I'm going to be there. Be Beautiful is going to be offering things. There's a huge discount on Botox and procedures, like 20%. And the profits from the Botox are going to go to ending blindness in Africa. It's a national Vanity for Vision program.
It's not our name. That's the national campaign.
Right. There's one plastic surgeon in every state is doing it. So on the 19th of May, Be Beautiful Salon. You can call them. You can call my office, 988-8886, to get details.
What time is the event?
It starts at 6, and there's going to be terrific discounts. And door prizes.
Oh, that's nice. And you're not doing the work there. You don't do that, right?
I don't do it there.
So you're the only plastic surgeon in all of New Mexico who's been hired to do this?
Yep.
That says a lot. That's
all
nice.
Right. Well, stay tuned.
Okay.
We will be back in a few minutes with listener emails.